Good afternoon, everybody, and welcome to WellVow's latest podcast. My name's Lisa Barnes, and I'm your host today. Today, we're going to be discussing the role of herbal medicine in women's health, and I'm absolutely delighted to be sharing the mic with Victoria Wright, a medical herbalist living and practicing in Oxfordshire. Hello, Victoria.
Hello and hello, everybody. It's really lovely to be here today.
So, Victoria, we want to cover so much today. We've got sort of 45 minutes. Let's start out. You started your career as a research scientist, not a herbalist at all.
hmm
How did you end up here?
That's a really good question. When I was little, actually, track back to when I was like 4 years old. I wanted to be a doc. Well, first I wanted to be a nurse, and then I wanted to be a doctor because doctors earned more money, and then I wanted to be a vet. And somewhere between the age of 4 and 5 and when I left school, I completely forgot all of this and went on studied physics, and I had really good fun doing that. I worked on all sorts of interesting things, sort of medical imaging techniques for mammography and drug discovery techniques and all sorts of fun stuff. But I knew I wanted to help people. There was that kind of need in me, and I found that the research that I was doing just wasn't immediate enough. And then I happened to be on a meditation retreat and I had this chance conversation with a doctor. I wish I could remember his name and I could thank him, but all I can remember was the conversation. And he said to me, "You'll work out what it is you want to do." And on the train coming home, I thought, do you know, I've always been interested in herbs and herbal medicine. I'd like to learn a little bit more about it. But being a massive geek, I wanted to learn properly. And so I ended up doing a degree just for fun. And that is what is history, as they say. It's like that just started me down this path of like learning more and more about medicine, about herbs, about the root causes of illness, and it's just taken me down a bit of a rabbit hole, really.
Wow, wow. So, you describe yourself when we've chatted before, you've sort of described yourself as naturally quite skeptical. And I know there is quite a lot of skepticism around um, herbs and medicine. Um, what was the moment that you realized that functional or herbal medicine could make such a difference?
So when I was in my first year of my degree, I thought I did the degree part time, so I could structure the modules essentially how I wanted. So I thought I'd do one of my clinical training modules first off to see what it was really about. And I was really, really skeptical. Um, to be honest, I thought it was a bit of nonsense, but I was going down this path anyway. And I also suffer from endometriosis, or I did do at the time, and I was in pain every single day. And I thought, do you know what? Let's see if it can actually do anything for me. Let's be a guinea pig, and see if it actually works. And they were always looking for patients at the training clinic. So I thought I'd be a patient. And I went from being completely in pain every single day to being completely pain free in 3 months. And it just blew my mind, actually. That I, you know, I'd had all sorts of treatment. I'd gone down the conventional route. I'd had the surgery. I'd had the GNH agonists. I'd had it all, and nothing had worked. I was still in pain. So to be pain free within 3 months with no side effects, no, just nothing it was like, okay, there must be something in this.
Yeah, I mean, I think
Um,
anybody who's suffered from endometriosis or knows somebody who suffers from it, if you can have an outcome like that
yeah,
through anything, you're going to start believing in it, right?
exactly.
What a wonderful way to come into herbs and
Yeah, yeah.
using them. Wow. So for anybody who's listening who isn't quite sure, what exactly is a medical herbalist?
Okay. So in the UK, a medical herbalist can give primary diagnosis. So if you're talking to a Western medical herbalist, they have had training in Western medicine. So I liken it a bit like going to see your GP. So we will ask the same sort of questions, do the same sort of physical examinations, um, speak the same sort of language as your GP. We learn the same structure of medicine as, going to do a medical degree in the UK. Um, so people will come in, we can do diagnosis, we can refer back to your GP, if we think there's something going on that needs further investigation in that same kind of language. The difference is, and the layer that functional medicine adds into herbal medicine as well, is that we're looking at the root cause of illness. So we're looking at what's really causing that dysfunction. And that can be a whole range of things. But by looking at what's causing that problem in the first place, and then making an intervention there means that we can have a lot better outcomes.
Mm.
And then the difference is then, you know, we prescribe herbs. Now, that's not the sort of herbal supplements that you'll get over the counter. So if you go to Holland and Barrett, for example, and buy some sort of herbs there, it's very different. So we use herbs that are a lot stronger, um, and you will get a mix of herbs that are put together particularly for you. So it's very personalized medicine as well. So if you came to me, um, let's talk about endometriosis because I mentioned it. Two people who come with endometriosis may have slightly different symptoms and may have slightly different root causes. So would get different medicines, because it's just so personalized as a form of healthcare. But then we don't just say, here, take these herbs and off you go. We're looking at your diet, we're looking at your lifestyle, we're looking at all of those factors that influence health as well, and bringing all of those in to actually making sure that as a whole person you are well.
So, do you call yourself also a functional practitioner?
Yes, yes. So I've also done so functional medicine is it's like an add-on training. So you have to have some form of health, well-being, medical background in order to be able to do the functional medicine training. And that goes in a lot more depth into the physiology of disease and really unpicking those root causes as well. So I've studied that as well. I
Hmm.
am a geek.
You are a geek. You like studying, don't
I
you?
do. Yeah.
So we've talked about endometriosis, which I'm sure we've got lots of listeners who would be fascinated to know more about. This is World Women's Health Month, so it's absolutely very relevant to be discussing endometriosis, but also hormones as a whole. Um,
Mhm.
what your big argument that you have around cortisol, insulin, and gut health driving many of your symptoms, which are historically and usually blamed on estrogen and possibly progesterone. Can you
Mhm.
unpack that for a little bit for somebody who has gone to their GP and just been told, oh, it's your hormones, you're in perimenopause or you're menopausal?
Yeah.
Tell us more. Tell us more.
Okay. I hope you don't mind. We're just going to geek off a little bit about the endocrine system, if that's okay. So,
Keep it fairly
yeah, yeah,
simple.
yeah, yeah. Don't worry. So the endocrine system is your body's hormone system, and that controls the majority of how your body works, and it includes your estrogen, progesterone, testosterone, so your sex hormones, whether you're a man or a woman. It includes your stress system, so cortisol, which is your stress hormone. It includes your thyroid, which is a little organ that sits here. Um, it includes your blood sugar hormone, which is insulin, and it includes a whole bunch of other things as well. Now, when any of these hormones are off for whatever reason, then it will affect all of the others. And then, the classics classic one is is the relationship between stress and sex hormones. Now, in the body, they come not predominantly, but they come from the same um, root chemical in the body, which is something called pregnenolone. You don't need to remember the name of it, but you just need to remember there's like, you know, the same product is metabolized, it goes into and is produces the same hormones. So I liken it to you've got like 100 hormone pounds in your hormone bank account, and how your body spends those hormone pounds each month will depend on what your body needs. So if you're stressed out, let's say, you've got kids who are causing trouble. It's been GCSEs fairly recently. So, you've got kids who are stressing out over GCSEs or A levels or, SATs or whatever exams they're doing. You've got parents who are struggling, you've got a busy career and you're under a lot of pressure. Then your body goes, whoa, hang on a minute. We need to produce cortisol first. That's the priority, is coping with the day to day. So it diverts all of those hormone pounds into producing cortisol. Now, if you um, need to produce estrogen, there isn't enough pregnenolone left. So your body goes, well, we can't do that. We've only got 100 hormone pounds. So therefore, we're going to not produce as much estrogen. And that can cause all sorts of problems. It can cause you to not have periods when it's really extreme. It can cause, problems with infertility because you're not producing enough estrogen in order to be able to conceive or to carry a pregnancy or to ovulate. Um, there are all sorts of issues that will cause. Now, that's a really simplified version of what's actually going on in the body. But you start to then to be able to see, well, if I have a lot of cortisol, then that's going to affect all of the others. And then the same happens with insulin as well. If your blood sugar is off, if it's fluctuating wildly because you have a diet that's really high. I mean, you must know this as a nutritionist. You have a diet that's like wildly, full of ultra processed foods or high sugars, high refined carbs, then that's going to then start to affect sex hormones and thyroid function. And often the symptoms that we attribute to just your hormones may actually be being driven by other factors that may not seem hormone related, but then when you understand how it all interlinks, you realize that actually it is hormone related after all.
That was brilliantly explained. Thank you, Victoria. Really, so simple to understand it when you put it that way. What about the gut? Where does the gut come into all this? How does the gut, how does our gut health influence our hormone symptoms?
This is something that I think is really not well understood yet. And so I think that there's a lot of research that's coming out about what they call the estrobolome, which is the different microbes that are living in the gut that are affecting estrogen metabolism or estrogen production. And I think, this comes down to, at its simplest level, making sure that we are eating enough of the raw ingredients we need in order to be able to have a healthy diet, and having the nutrients and able to be able to produce the hormones and then eliminate the hormones as well can have a massive impact. I've not explained that particularly well, but that's,
No,
it's
that makes
really
sense.
new stuff.
So, I mean, you've already talked about how very personalized your approach is to
Hmm.
women's health or any of your clients' health. Are there any herbs that you do find yourself using again and again in women's health?
Ooh. Um, Yeah, I go through phases actually. I go through phases where I have my favorites, and everybody will get a bit of this because I'm seeing people that all think, oh, actually, they all need a bit of this. Um, but one of the herbs that I really like for women's health, which people you wouldn't associate it with women's health necessarily, is milk thistle. So milk thistle supports liver function. That's its predominant action, if you like. Now, that's really, really important because as well as producing hormones is important in the body, eliminating them correctly is important in the body as well. And if you have certain genetics, then you may not be, or you have conditions, so endometriosis, PCOS, for example, are likely to have an estrogen dominant type picture. And we can talk about that in a moment. But what that means, but it means that you need to be eliminating any excess estrogen. And so if you if you're not, if your liver function is not working as well as it could do for what genetic reasons, or maybe a few too many glasses of wine here and there, then we need to support liver in order to be able to make sure that you're not in that estrogen dominant state.
That's really interesting. And I mean, one of the focuses of this podcast is to give information to people who may not be able to afford to come and see a medical
Mhm.
herbalist. So this is, is milk thistle something that if you suffer from PCOS or endometriosis, that is safe to take regardless? Even if you
Yeah.
don't know any more about the root cause, but if you have one of those problems.
Yeah, I mean it's a genuinely a really safe herb. I would suggest buying a good quality, buy the best quality that you can afford. Um, there are some really nice supplements out there. Um,
Do you want to give us a good idea of some
I
it
don't,
because it's very difficult if you walk into Holland and
yeah,
Barrett or Boots or something, there's so much rubbish out there as well, isn't
I
there?
know,
And
I
you're
know.
just wasting your money.
I'll be honest with you, I don't buy over the count milk thistle, so I'm struggling to think of like which of the suppliers produce milk thistle. Um,
Okay.
but suppliers like Pure Encapsulations,
Yeah.
Nature's Gate, they're kind of they're nice quality products. BioCare produce really nice quality products. So if they were to produce a milk thistle
Yeah.
product, then I would buy from suppliers like that. But I can't give you a specific because I wouldn't
No,
normally
that's
buy a
fine.
supplement in that way.
What about for your clients who come to see you and they are already on HRT?
Hmm.
Is herbal medicine safe to take alongside HRT?
Okay, this is where you need to come and see a practitioner. So, one of the things that a good practitioner will do is take a full list of any medications that you're taking, and that can include HRT. Um, and they will um, actually do a review and make sure that any herb that you're taking will have no interactions with them. There are herbs that will interact with other medications, um, but a medical herbalist has the training and the knowledge to understand what those herbs are and make sure that any prescription doesn't include them.
Excellent. Really good advice. So don't just go taking these things if you are on
Yeah.
medications.
Yeah.
Super, super important because, you know, we always think, or it's sort of, we think that if it's natural, it's safe because we said it's natural. And, there's an awful lot of things in the world that are very natural and very, very dangerous.
Yeah, yeah. I mean, I do joke that I know how to kill people, because one of the first things that you learn to be a safe practitioner is what isn't safe. And a herbalist has license to use herbs that are considered poisons, but in a very small amount, then they're therapeutic. Like any, medicines over the cat that you can get prescriptions for, they can do harm in larger amounts. So, you know, yeah, being safe means understanding how to kill people.
Good advice. Wow. So, I mean, Facebook, Instagram is flooded with supplements, herbal supplements, and an awful lot of them certainly don't have the background and the training that you have.
I know.
You've got these celebrities sort of endorsing things. What frustrates you the most about the way that herbal medicine is portrayed or advertised online? And I guess that's two different things.
Yeah, yeah. I've got 2 points actually. The first is herbal medicine, like popularism, tends to go through phases. So at the moment, it seems to be mushrooms.
Mm.
Everybody's talking about lion's mane and these mushroom gummies and all sorts of things like that. Um, a couple of years ago, it was turmeric. Turmeric was the cure-all for everything. Um, there have been others that go along. Um, and it's brilliant that they get airtime, but they're portrayed as a cure-all, and they're not. They are really powerful and effective for certain conditions, for certain profiles. But if it's not the right herb for you, it's not the right herb for you. And I think understanding that, just because your mate says, "Oh, I've tried these mushroom gummies and they're amazing," it doesn't necessarily mean that they're going to be amazing for you. But it doesn't mean that they're not good either. It's just that you know, you wouldn't go and you wouldn't go and take PPIs or antibiotics that your mate had because your mate said they're brilliant and you have something completely different. It's the same sort of thing. So that's one aspect of it. But the other aspect is, and I'm assuming that you've I'm hoping you feel the same actually, is that, I see all of these like menopause supplements and they're touted as like being these amazing menopause supplements, and they're stupidly expensive. They are ridiculously expensive, and they are just a multivitamin with maybe one or two herbs in. And there's probably, given that they're also a multivitamin, not a therapeutic dose of those herbs in them. So you may feel good, but you probably feel good because you're taking the multivitamin and you're just getting the nutrients that you need. And if you changed your diet, you would feel as good. Um, but you're paying an awful lot of money for something that you could go to Sainsbury's and probably buy. Um, so that's the other frustration.
We're a very vulnerable market, aren't we? And if you are in perimenopause and not feeling as good as you did a few years ago, you'll
Yeah.
throw money at it, and you'll
Yeah.
believe anything. And our social media is absolutely flooded with it. So, very, very true.
Yeah. And I think if you've got money to throw at it, throw it towards a practitioner, be it a nutritionist or a medical herbalist, somebody that you can trust, who you know will give you the advice, so that long term you actually save money on supplements because you're getting the ones that you actually need rather than just going, "Oh, I'm going to try this one and I'm going to try that one and I'm going to try that one." And I saw somebody recently who they were taking like 10 different types of supplements, and three of them were all the same. And it was just like they were just marketed in different ways.
I see that.
Um,
Actually, you're then looking at taking far too much of something, uh,
yeah,
and the whole balance goes there as well. Yeah, you're absolutely.
yeah.
So, who's the sort of client that you would normally work with, Victoria? What's your normal sort of client? Not that anybody's normal.
No, I never work with normal people. Um, the sort of people that I work with tend to be people who have either they want to try a more natural route. They know that there's something wrong with them, and they know what it is, but what they're being offered in terms of medical treatment isn't something that they want to take, either because the side effects are too great or they don't want to be on medication forever, they want to try a different route, or it's somebody who's been dismissed. Unfortunately, conditions like PCOS, which is now being renamed to PMOS, these kind of conditions are often dismissed. So perimenopause, unfortunately, still is as well. They'll go with a bunch of like weird, not quite feeling quite right, but they know something's wrong. And, their GP will say, "Oh, it's just your age," or "It's just your hormones, love." And that's it. That's the end of the conversation. So I see a lot of women who come because they want diagnosis, they want to understand what's going on in their bodies. And by, having that understanding, then they can make choices about their own health care, longer term.
Yeah, yeah, absolutely. So when a person comes to see you, we're talking about women's health, so let's assume
Yeah.
it's at the moment, but I believe you'll see anybody, will you? Do you see children?
Yeah. I do have a few male patients who come and see me. Yeah. I
This
just
is
like to specialize.
particularly talking about women today. What does your program look like usually?
So we normally start with an initial consultation, which takes around 90 minutes. We talk about everything. We talk about life, past history, medical history. We talk about poo. Everything gets uncovered, and that allows me to do a real diagnosis about what's really going on with somebody. And then typically people will sign up to work for me for 3 months. I suggest people work with me for 3 months because hormones are very slow and it takes a monthly basis. It takes, month after month to see a real benefit. But after 3 months, you can normally see massive changes. You're going back to the start of this when I was talking about, my endo. It took 3 months for me to be pain free, but I was pain free within 3 months. Um, and that's because our hormones are very slow to change. Um, that doesn't mean you can't have symptomatic relief more quickly. It's just to make those real, like fundamental changes, that physiological changes takes a little bit of time. So, yeah, typically people will sign up to work with me for 3 months. We'd have a consultation once a month. It's a very coaching style conversation. So you come and we'll talk about, how's life going? People often find that they don't notice what the herbal medicine's doing, but they notice that they're starting to make changes to their life. They're starting to have more energy so that they can do the things that they wanted to do. They've started to exercise more. They've started to cook more. They've started to really look after themselves more. Um, and often say, they're not sure if it's the herbal medicine, but here are all these changes that they're making to their life that maybe they hadn't been able to before because they hadn't had the energy, they hadn't had that motivation.
Yeah. Do you use any testing? Do you use laboratories and things?
Yeah, I don't use do a huge amount. I find with a good consultation, you can do a good diagnosis with consultation. Um, but for some people where there's something, you know, we can hint at it, but actually we need a bit more evidence to understand it. Then I do offer laboratory testing. What I've started to offer which people are taking up quite frequently is now medical DNA testing, because that allows people to understand what their risk factors are.
So tell
So
us a little more about that.
yeah, so um, I actually got interested in it because of my own um, family medical history, but there are certain genetics which will lead to things like risks for breast cancer, diabetes, and the sorts of testing that I offer is looking at genetic. They call them SNPs, which are kind of little tiny pieces of your DNA. They're looking at those which actually you can change through lifestyle and dietary interventions. Um, and they're really powerful because you can understand, okay, this is why I have this family history of breast cancer. And here's something practical that I can do to change it. Um, and I can do tests for like things like weight gain, particularly menopausal weight gain it can be a huge challenge for some of us. But actually, when you look at the genetics, then you can start to see why that's happening, and what type of exercise you should be doing, where there's nutrient gaps based on your genetic profile. Um, And that doesn't mean that, you're necessarily it's gonna solve all your problems just by knowing, or that you will necessarily get breast cancer because you have this risk profile. But I find it really powerful because it gives you that understanding, which allows you to then go, okay, I can now make changes, because I understand what impact my genetics are having on me, and I don't want them to have that impact. So I'm going to look after myself a bit better.
Yeah. So with everything that you're talking about, obviously it seems to me that you might often have a woman coming to see you with thinking it's one thing, but as you dig deeper into her history, maybe into her DNA, um, you are finding that actually what she's come with is very different from what you end up trying to support her through. Is that what would you say?
Not entirely correct. I would say she's come in. So when what medicine does is it takes a symptom profile and it names it. And that's great because it gives you a label, it gives you something to work towards. But that's not necessarily what's caused that symptom profile. If you take endo as an example, um, you know, it's endometrial-like tissue growing abnormally in the womb or elsewhere. Now, what's causing that, what's driving that can be estrogen dominance, inflammation, a whole bunch of other factors can be driving that to happen. So it's not that I'm not treating endometriosis. It's just that I'm looking at what's driving it in the first place. What's that root cause? And I think that's where the power comes because, if you go to your GP with endo, they'll put you on the pill or GnRH and agonists, or you'll have surgery, but they're not looking at what's what's really causing that. And I think that's the kind of like new medicine that's coming out from the functional medicine perspective, and the new research that's coming out, which I'm hoping will end up in the NHS at some point. But at the moment, it's just not there.
I mean, we're talking to you about the way that your protocols work and your courses work, the amount of time that goes into digging deep to find out those root causes. That's not going to happen in a 10-minute GP
Um,
uh, consultation. So, you can see why it doesn't really work at the moment
yeah,
in primary healthcare, which is such a shame because, well, for all the reasons that we've mentioned, it's such a shame.
yeah,
But
yeah,
it shows the power of having these one-to-one connections with a really experienced practitioner
yeah.
who will find that root cause rather than put a sticking plaster on it.
Yeah, yeah. And I do love the NHS and I love primary healthcare. I must say that out loud because, it's just the most amazing thing, and I'm the NHS biggest supporter. I just think, you know, women's health has been done a disservice, I think, traditionally, for a whole host of different reasons that we probably shouldn't go into on this podcast, but um it does mean that there's a gap that is underserved for women particularly.
I agree. We've not got much time left. Let's go into sort of myth busting and practical takeaways, Victoria. So, what is a piece of hormone advice that you wish you could ban?
Oh,
Putting you on the spot.
hormone advice that I wish I could ban. That's
Yeah,
a really good question. I'm not sure I've got a hormone advice that I wish I could ban. Oh, I have a
putting,
bit.
yeah, go for it.
I was going to say I have something that I wish I could ban, which would massively affect hormones. So should we go with a substance instead of advice?
Do that.
Okay, and that's sugar.
Yeah.
I mean, I'm the worst. I have a terrible sweet tooth. Genetically, I have a sweet tooth. I'm really bad. I love the sweets. But oh my God, it's so bad for your hormones. Um, you know, for a whole host of reasons, it increases inflammation, and inflammation drives period pain. It destabilizes your blood sugar, and that destabilization of your blood sugar drives hormone issues. It's really the devil when it comes to hormone health, unfortunately. So can I ban sugar instead?
All ban sugar. Although I do still want cake occasionally, but
Absolutely. Yeah. Yeah. I do, I say to my patients, let's do an 80-20. If 80% of the time you eat a good, healthy diet, then, having a piece of cake occasionally or an ice cream in this hot weather is
mm,
not going to kill you. But if you're having the ice cream every single day, then I'm going to ban sugar.
yeah, and let's ban it from those shops just at eye height for children. Let's. Um, so next question. Is there a popular supplement? We sort of covered this, but
Yeah.
is there a popular supplement or herb that you think women are taking far too casually?
Um, I'm gonna go with the adaptogens at the minute. So the mushroom gummies.
Are everyone.
I know, I know. And they are, adaptogen. I use adaptogens an awful lot. There is probably an sorry, I should explain. An adaptogen is a group of herbs that work on the adrenal glands. So they help your body cope with stress for longer. And they're amazing, There is not a patient that doesn't have an adaptogen in their medicine, I don't think, because they're such a powerful group of herbs. And mushrooms, so lion's mane, is a form of an adaptogen. It does other things as well, but it's an adaptogen. And they're brilliant. But, you know, just chewing them as sweets isn't solving the root cause of the problem. And, all of my patients who get adaptogens, we talk about stress management. We talk about what you're doing to look after yourself, your sleep, how you're resting, and just taking adaptogens is not.
Especially when you look at what's put in these gummies to make them palatable.
Oh,
You know?
no. I mean, this is the problem that I have with herbal medicine. Yeah, it tastes absolutely disgusting. It
Yeah.
is really awful. And I always warn my patients, it's like I'm going to give you this really nasty tasting liquid. You're going to hate the taste of it, but it's going to do you some good. The fact that you can take them and they taste good. I'm like,
Beware. If it
yeah.
tastes good, it's probably not doing you the good that if it's tasting absolutely revolting would be. Yeah, absolutely. Um, what do you think women are getting wrong when they talk about lowering cortisol?
Oh. Okay. Maybe that's the piece of advice that I'm gonna like ban actually, is that you need to lower your cortisol. Um, your cortisol's really important. It's a really, really important hormone in the body. Cortisol is what wakes you up in the morning and gets you out of bed. So your cortisol spikes just before you get up, and then it drops down, and it should drop down gradually throughout the day. And you need that profile. That's the thing that's going to motivate you. Um, I do a talk actually on cortisol rhythms, which is really like fascinating stuff because it shows how you go from normal cortisol through to burnout. And there's a pattern that happens that you can look out for. But to just say you need to lower cortisol, it's nonsense. You don't just, if you just lowered cortisol, you'd have symptoms of burnout. So what's important is to get to a natural cortisol rhythm. And for that, you need to be focusing on making sure you're getting good sleep. I hate to say it, it's really boring. Get good sleep, get out and get some daylight, particularly of a morning. Do things to look after yourself. Do some exercise. Again, if you can do it earlier in the day, brilliant. All of those little things add up. Um, so it's not just about lowering cortisol, it's about caring for yourself and having a natural cortisol rhythm.
Yeah, absolutely. If you could get every woman in her late 30s, early 40s to understand one thing about her body before perimenopause really kicks in,
Hmm.
What would it be?
Ooh, I like these juicy questions, Lisa. These are great.
You-
Um, what would it be? I would say listen and trust your own body. That's your body will tell you everything you need to know. Um, you just have to listen to it. And if if you're in your 30s and early 40s, I mean, I'll be honest, my perimenopause stuff started happening when I hit 40. That was it. I hit 40 and all of a sudden my body changed. I was like, whoa, this is new. Um, but if you start looking after yourself, start managing things like your blood sugar levels and making sure they're nice and stable, start managing, your sleep, making sure you're getting enough rest, managing stress, making sure you're looking after yourself. Um, do that as early as possible. You won't have menopause symptoms. You'll just have menopause. And isn't that brilliant?
Yeah, absolutely. Absolutely. So finally, where should someone start if this conversation is the first time they've heard of you or heard of herbal medicine and they're thinking, this sounds like something that I could really benefit from?
Okay, so if you want to connect with me personally, if you like my slightly geeky way of looking at hormones, then you can book a free conversation with me. I'm sure the link will be around somewhere. I
Put it in
also,
the chat. We'll put the link in the chat.
excellent. I also do a free monthly-ish workshop called Hormones: What They Should Have Taught You at School, where I go into a lot more detail about hormone bank accounts and all of the things that affect hormone health. That's probably the easiest thing is to come along to that. It's great fun. I get a lot of abuse from the participants, but it's really good fun. And if you're interested in herbal medicine, but you don't want to connect with me personally, then I would suggest going to sites such as the National Institute of Medical Herbalists, who have a register of all they hold the standards actually for herbal medicine, and you can find somebody locally to you on their register, which is on their website.
I think also if you're on WellVow, you'll find other medical herbalists who might be more local to you. Victoria, remind me, where do you practice out of?
I'm based in Oxfordshire, in Witney and Wantage, but I also see people online.
Okay, that's great. So if somebody was based in Oxfordshire or happy to see you online, they can get in touch with you. We'll put the link in the chat afterwards. You can access Victoria through the WellVow website, or we'll also put your website on. Remind me, what's the name of your company,
The
Victoria?
Living Herb.
Living Herb. Lovely. So we'll put all that on. Thank you so much for your time. Wow, that was an hour of geekiness that I absolutely loved. And it's taught me loads, and I hope that other listeners will have really benefited from your vast experience and wisdom. Um,
Thank you.
I'm hoping that, as we progress with WellVow, you'll be uploading blogs and things so that everybody can keep up to date with what you're up to.
Yeah,
Um, there'll be lots of information on there, so following this month of women's health, and I'm sure that you'll contribute to that as well. So thank you,
absolutely.
Victoria. That was a fantastic way to spend a lovely Monday afternoon.
Cool. Thank you.
Thank you.